Dr. Hawary, there is this thing called orthodontic work, basically straightening out the teeth with braces. It's well known, most teenagers do it, many adults these days do it. And there's also this new thing, and it really isn't so new anymore, but it's still relatively new, called Invisalign. And apparently it's really catching on very heavy because it's so comfortable, does a job so fantastic, and has so many advantages without making the other braces necessarily unnecessary, but it just has great advantages. And I know you're doing and providing Invisalign treatment, which is orthodontic treatment. So go ahead and tell us a little bit about some of the uses of Invisalign, please.
Well, Invisalign is the new era in orthodontic movement. It's a computerized, generated technology where we design everything, all the movement of the teeth that we would like it to happen on the computer with the software, and the software will show us what will happen through the process all the way to the end, and will calculate, and it will calculate the number of removable aligners. So basically, Invisalign is a removable aligners. And these aligners,
like kind of a mouth guard, right?
It's a much thinner than a mouth guard.
Sure.
It's a plastic shell that goes over the teeth. It's a little bit flexible, but has some hardness to it. That will be an active retainer that moves the teeth in the direction that we want them to move into it. It's removable, so patients can remove them several times during the day whenever they want to eat, brush and floss, and put them back. So they are much more convenient than having the wires of the braces. They are removable, so they can move them when they want. They should have the Invisalign aligners 20 to 22 hours per day. So there is enough time where they can remove the aligners for convenience.
Maybe for eating, right? They must remove it for eating, right?
They must remove it for eating because it's a major advantage of the aligners, so you don't eat with the plastic in your mouth or with the wires like the old days with the braces, and food gets stuck everywhere, and you spend, 5-10 minutes cleaning and brushing and flossing to remove everything stuck into those wires. Nothing would pinch like a wire coming into the cheek or the tongue, and all of that inconvenience, and the teeth will be cleaned better. So it's a lot more hygienic than braces. Beside the fact that, which I like the most about it, it's a computer-generated technology where we see the end result before we start. So we plan everything. We know exactly what we get. If a movement would not happen, we know at the beginning, so there is no guesswork, and it's usually, in my experience, faster than braces as well, which is a very big advantage as well. Beside the convenience, the way that it looks natural, and eating without anything in your mouth, it's also predictable and fast.
Beautiful. Now let me ask you, first of all, are those Invisaligns really invisible?
Yes, they are. I have in my practice hundreds of cases with patients that talk for a living, lawyers, people that do sales, etc., and they don't show. I mean, at a talking distance from the patient, you can barely see anything in their mouth. And they get very confident. They never have a problem talking, And as I mentioned, they are to a great extent invisible. However, if somebody has a major event or presentation, or
that first date.
Yes, the first date, exactly. If it has food involved in it, then they will probably have to have no trays in their mouth anyway. But in my opinion, that's what I want to say in other words. They are allowed to keep it out of their mouth for a while. So it is invisible if it is in their mouth, but also if they need to remove it for an important event, they have the right to do that.
Got it. So the next thing is, so the person takes home a bunch of trays. I don't know how many you give him. So he still has to come in and get checked every few weeks or every month, and then he gets a new tray and he keeps putting it in and he keeps getting a new tray. Is that kind of how it goes?
Yeah, the way it works, each tray for each arch works for 2 weeks. So if the patient wears the first set religiously, the second set would automatically fit. So in my practice, we don't have to have the patient comes every 2 weeks for convenience, but we give them several trays, at a time, providing that they wear them. If they have any problem putting them in, then they come back and we help them or identify the problem for them.
Right.
Nevertheless, there are some steps that are required and needed, and in certain steps, there are some work has to be done on the teeth where the patient definitely has to be in the office to have that done.
All right. Now, Invisalign was at the beginning meant for adults, very, very much so, and it's definitely convenient. And the reason it was meant for adults is that teenagers have a higher tendency of taking them out, putting them there, seeing that girl or that boy, and forgetting all about their retainer and losing it. What have you noticed in your practice? Are you putting it on teenagers also, and do you not have much problem with it, or do you?
I do. My practice have more adult cases than teens. However, there is a new thing that Invisalign introduced for teenagers that has certain things that would monitor if the patient is really wearing their trays or they are not. So it tells us exactly if they are compliant or not. However, the truth is an adult is easier and more compliant than a teenager. However, I have seen a lot of teenagers in my practice that are very good at it. They wear it even before those indicators have been introduced to Invisalign, and we have seen beautiful, extreme results through Invisalign and their compliance to use them.
Well, the reason the teenagers in your practice comply and wear them all the time is probably because you show them the baseball bat all the time and they're going to hit you with it if you don't. So it's very easy to get them to comply that way. Another question. When people wear here's a big advantage I've heard, and I don't know whether that's true, but when people wear their normal braces, which is still, in fact, some teenagers prefer them because they can put the flag of the Lakers on it or whatever it is they want, and it's even a fashion. You have all those disadvantages. Food and brushing is a big one. I've heard that sometimes when a person is not a good brusher, and when you have the braces on it, you need to be a very, very, very good brusher. A little bit like when you have bridges in it, where you need to be a very good brusher and flosser, otherwise you accumulate gum disease. So sometimes it happens, the teeth are all straightened up after a year or two or whatever it takes, and the braces come off, and now the person has gum disease or other type of, all kinds of discoloring on their teeth. Is that true? And with Invisalign, apparently that doesn't happen because he brushes every day.
Definitely, Invisalign gives you the convenience of being able to brush and floss without the hassle of having the wires. Having this set doesn't mean that every person with the braces would have a gum disease. There are a lot of people that can brush and floss. However, dentistry today provide an easy solution that I would take an advantage of if I need braces today, because Invisalign, beside the convenience that we talked about, keeps the teeth very healthy, no plaque accumulated, and gum is not bleeding, and it's easy to brush and floss. compared to the inconvenience of that in the braces. Absolutely, I agree with that statement. Doesn't mean that we don't do braces or we don't still utilize braces, but we utilize them whenever it is really needed for that.
So there are some cases where Invisalign simply cannot be applied and you need to do a normal braces. Just like there are some cases where a crown is better than an implant and some places where an implant is better than a crown.
Yeah, I mean, it's a great innovation. It's a great thing that we can move teeth. It's like a dream come true that you can move teeth without having braces. So I believe in it. I've experienced how good it is. I've seen major results with the Invisalign. Nevertheless, some cases require still braces, and there is nothing wrong with braces, and we need to do braces whenever there is no other way to move the teeth except with those wires.
Thank you very much, Dr. Hawary.